Are the lab numbers more important to you than the patient's symptoms, or do you consider both when prescribing? This video is sponsored by MeWe, the #1 pick for men on TRT. Shop now at MeWe using the link in the description under this video.
So again, that's the art and the science of medicine. We have gone from, so the way doctors used to treat patients in the past, we didn't have blood tests. Do you know the first way somebody was able to use testosterone? I forgot the name of the doctor. He injected himself with extract of testicular cells. And then the way we were treating low T in the past is if you have the typical symptoms, and that also includes thyroid when we didn't have labs. If you have the typical symptoms, the doctor, if he's a good clinician, a good diagnostician, he will come up with a differential diagnosis and then use different modalities of treatment and see how the patient responds. So back then, doctors did not use numbers. There were no blood tests back in the 50s and 60s when doctors were treating patients. So now that we have all the science and all the numbers, we tend, and when I say we, it's not only doctors, it's also patients. I have patients who are so focused on numbers, they forget about how they feel. So it is a combination of the two. Yes, we need the science, we need the numbers to help guide us, but we cannot forget the art of medicine. We cannot forget the humanistic and empathetic and human approach to medicine, where we combine the numbers and how you feel. I have guys who feel great on TRT with levels of 600 to 700. I have guys who only feel good at 13 to 1500. Everybody's different. So this is why what I encourage really all of our viewers and anybody I speak to is get yourself a good doctor. Listen to all those channels. Listen, first educate yourself, empower yourself to make better decisions. And if you cannot find a doctor who takes the time to listen to you, look over your numbers, but listen to your symptoms and come up with a comprehensive plan to make you feel better, no matter what your numbers are, this is the best approach for our patients.